Hello everyone! In the current era, you can change almost everything in your appearance, whether it's functional or aesthetic. Our video today is about a type of plastic surgery that has become a very famous surgery. Although it seems a very simple surgery, but it can totally change the look of your eyes. Today's video is about Epicanthoplasty. I'm Queenie. Before we start, please subscribe to our channel so next time you'll be updated with our new releases. Epicanthoplasty is an eye surgery that modifies the epicanthal folds or the Mongolian folds. It is medically known as medial or lateral epicanthoplasty, and it aims to lengthen the inner part of your eyes to make the eyes bigger. The surgery, also known as inner corner fold removal or the Mongolian fold correction. It is a cosmetic procedure mostly performed in Asian countries. Our role today is to answer most of your questions regarding epicanthoplasty. Today we have Dr. Park, who is an accomplished cosmetic surgeon and professor in Seoul, Korea. He is going to discuss with us about epicanthoplasty from an experienced point of view.
Greetings. I am Park Jae-Woo. I have had this cosmetic surgery clinic for about 15 years. I have also been a professor at a university for about 12 years. As a cosmetic surgeon, it has been about 30 years.
That's a very long time. Okay, Dr. Park, for my first question, are there any changes between the previous and current epicanthoplasty techniques?
Epicanthoplasty deals with the internal eye area surgery. Since many Asians tend to have a less open eye area, men pursue this procedure. Long ago, there were many techniques, but the majority of the techniques were based on repositioning tissue underneath the eyelid. But there were many issues with scarring after surgery, so many patients disliked the outcome due to the scarring. Thus, many desired improvements upon this procedure in order to avoid the scarring. So now we utilize a technique called redraping in order to minimize the potential for visible scarring. Using the redraping technique, we make sure that the scars do not show up outside.
So which type of epicanthoplasty you mainly do in Korea?
Like I said recently, in Korean, the norm is to use a skin redraping technique, which limits visible scarring by relaxing the muscle tissue in the epicanthal layer.
Can you briefly explain the difference between those techniques that you have mentioned?
Yes, the fundamental issue is whether the epicanthal layer of the eyelid is open or closed. In general, Asians have closed it due to the presence of muscle tissue, so they aim to relax the muscle in the epicanthal layer. However, in the years past, the problem was, the aim in the past was to alter the skin, how to extend or cut, but today the technique to relax the muscles beneath in order to achieve the desired appearance. The problem is the muscle beneath, not the outer skin. Long ago, surgeons simply cut the skin, so there were issues with the visible scarring, but today we view it as a muscle tissue issue, and the skin is something that follows naturally when the underneath muscles are rearranged. So the concept is different now.
So how do you find the perfect eyelid shape for your clients?
When patients arrive, we ask what kind of eye look they want. Among those who visit me, there are many Asians and many Russians. So as I alluded to before, there are some differences between Asians and Russians. Asians, like Koreans, tend to have eye shapes that is slightly closed but not enough to impede with vision. The white area to the left and to the right of the center are well proportioned. The white part close to the center of the face is proportioned at 1, and the white part of the side is proportioned at 1.5x. That of the white part close to the center of the face. If so, it is pretty. Also, a mild doubled eyelid size 6 mm to 7 mm. Also, the upper eyelid should cover the center of the eyes about 1 mm to 2 mm, while the bottom part should barely touch it. We prefer this type of proportioned eyes. So the question is how far or close is the current eye shape? Thus, how will we achieve this desired eye shape is what we discuss with the prospective patient.
What kind of person is not suitable for this surgery?
As discussed, epicanthoplasty is suitable for those with a closed eye disposition in the area. However, if the patient already has an open eye area, the procedure cannot be done as there is nothing to open up. So if the procedure is done in such cases, problem ensues. Also, the muscles should be relaxed only as needed, as if it is done excessively. The problems occur when the original state reverts. So opening up the muscle layers as needed will have good results.
So, what's the difference between epicanthoplasty for Western and Asian clients?
Westerners already have an open eyelid, so there's no need to open further. However, there are some Westerners who have partially opened eyelids. The reasons are two. One, some are born that way, and some become like that as they age. As they age, the eyelid droops and closes a bit. In such cases, we must open a little. Also, in pronounced double eyelids, it can impede the opening. Thus, in such cases, we can open up more.
Okay, so what kind of eyelid shape do Asian clients mostly request?
Mostly they say it is difficult to open their eyes wide, but they do not know the reason why. And my eyes look too round and wish to extend sideways, but not too much so. These types of people tend to undergo the surgery. So we can look at this case where she only had this procedure done in the front side, yet the eyes look wider now. I opened only 1 millimeter, yet the change is visible. Asians prefer elongated the side openings. Among Asians, there are many who have too much tissue in the eye area with too much fat in the upper eyelids. In such cases, we need to open wide. But every person's situation is different in a way. Some have drooped eyelids, which can be fixed by opening the eyes in a pronounced way. In this person, the eyes are small and roundish. It can be fixed like this picture. We can show multiple pictures and arrive at a consensus with the patient for her desired look. With this person, I wish her eyelids were more opened in the rear, like this.
이 사람 보면은 눈이 작고 둥글어요. 이런 경우는 이렇게. 이 눈의 형태에 따라 자기 얼굴에 따라서 이제 보여지는 게 다른 거야. 이 사람 같은 경우는 뭔가 뒤가 조금 더 열려졌으면 좋겠어. 그래서 앞도 열고 뒤로 열고 전체적으로 이렇게 가는 거야.
So for our next question, what is epicanthal fold?
As for the epicanthal fold, in the past it was said that the Mongols have it, but in reality, about 70% of Asians have it. So the epicanthal folds can obstruct the frontal vision. This is due to the existence of a muscle that connects to the upper and lower eyelids. Why is that? When we were in the mother's womb, it was supposed to disappear. When we look at Westerners, they do not have it, but Asians have it. That is why the fold exists. In surgery, we need to cut the muscle. So in the epicanthal fold surgery, we cut the muscle that connects the upper and lower eyelids.
What is canthoplasty? Is it a must to do it with epicanthoplasty?
Like I said before, the proportion between the frontal and side of the eyes need to be well balanced in order to achieve optimum proportion. We do the epicanthoplasty or medical canthoplasty or epicanthoplasty. Deals with surgery of the frontal area, while lateral canthoplasty deals with surgery on the sides of the eyes. Right? So the result is first, the angles change from slant to a more even look. There are many Asians who dislike their eyes slant. So to achieve a more balanced look, we open up the lateral area to match the frontal area. So in order to achieve this look, we do both medical canthoplasty and lateral canthoplasty. Same with this patient. We achieve the desired well-balanced look.
So how do you resolve the aesthetic difference between yours and the client's?
Even if I suggest what could be beautiful, the patient has her own mind as to what she desires. Some want otherfold, some want outfold, and some want infold, and some want parallel. Some want thin folds, some want medium, and some want high creases, while some want tapered, and some want parallel folds. creases. This is because everyone has their own ideal look. So the patient's preferences is important. But there are some who look good at certain procedures and some who do not. So it is a consultative process by which we decide on what procedures to go with.
What would doctors do to solve unbalanced eyelids after surgery?
After surgery, many do it again for a variety of reasons. It could be due to various scars, unbalanced looks, etc. In such cases, we must do the surgery again. But we must know exactly why the patient wants to undergo surgery again. For example, if we look at this patient, she had surgery before, but her epithelial layer is intact, and the eyes are not balanced, which must be adjusted through surgery, so that the frontal area is opened, but not too much. So after a month, she looks like this. And in this picture, it has been 4 months, and it looks much better. It is important to know the root reasons. In her case, opening her eyes fully was compromised before, and she had a frontal fold, and due to her excessive fat in the outer eyelid layer, which pushes her double eyelid to diminish it. So we took away her eyelid fat, then rearranged her folds, then raised her eyelid angles, and we arrived at this look. If we look at this patient, the double eyelids that were done before were all disappeared. In her case, we cut the epicanthal folds on both sides and removed the upper lid fat, and we made her look like this. This has been around 6 months since her surgery. Right. So, in the past, we simply made a double eyelid. Now we focus on how to make a double eyelid that fits her unique face.
What would doctors do to solve double eyelid scars when that was too pronounced after surgery?
Yes, this type of scar we call sausage. The reason we call it a sausage is when the fold is too big or when the muscle tissue right below the fold was removed excessively. In such cases, we need to remove the sausage and do surgery once more. So it is important to do surgery tactfully. And if the sausage appears, we can remove them and redo the surgery.
How often do patients come to you or come to Korea after their first unsuccessful epicanthoplasty?
As I said before, the reason is because the surgery was botched, possibly cutting less than necessary, or it was cut excessively. If it was cut more than necessary, then it must be closed again. So there are many reasons why it can be botched. If it was cut less than needed, then cut more. Also, when opening the area, instead of the skin, it should be the muscle beneath. And if too much was excised, then it needs to be closed again. So depending on the patient's problems, we can act upon it. We carefully look for the errors and perform the next surgery.
But is it difficult to redo the work from other doctors?
For patients who come for redoing their prior surgeries, it is key to see what the problems are. For example, some cannot open their eyes, and why? Did they cut too much of the muscles needed for opening their eyes? Or did they cut too little? Did they cut off the muscles drop off? Or are they born that way? We look at the entire issue to resolve it. For example, in this case, it is a patient who cannot fully open their eyes, which was congenital. For such persons, if they come when they are young, we can perform the surgery and it works well. But if they come as an adult, we ask why their eyes are different. Did she already have surgery that was botched? So in this case, we can see that the surgery may have been wrongly done in prior times. In these cases, we have to solve the issues. In this person's case, we already have problems with fully opening his eyes, but as he aged, it got worse. So these people's issues are all different. Thus, performing surgery knowing their unique problem is the right way to do it. Since many do it for looks, we can tell if the issues have been resolved through surgery.
So, to whom do you usually do epicanthoplasty in a non-invasive way?
Non-invasive means not using a surgical knife.
칼을 대지 않고
As I explained before,
주사를 하거나
these are surgical procedures, so we cannot perform epicanthal surgery without a knife.
인베이시브는 할 수가 없어요.
What if the patients want to do laser eye surgery and epicanthoplasty? Which would you prefer the client to do it first?
이 시정 교정 수술
Laser eye surgery is surgery to improve sight. There are many methods to do laser eye surgery, but many require 6 months rest afterwards. Thus, in such cases, we ask the patients to do the laser eye surgery first, as the recovery may be hindered if we do epicanthal surgery too soon after the laser eye surgery. Also, double vision or blurred vision may occur. So we ask first to do the laser eye surgery prior to the epicanthal surgery.
So how eye lift or brows lift are done?
Eye lifts are done when eyebrows are drooping. If there's drooping, there are many methods to the lift. For example, we can do an incision and lift everything up. This is for older people with lots of wrinkles. When there is severe eyebrow drooping and lots of wrinkles, open surgery could be best. But for those who do not have too many wrinkles, we can employ an endoscope and lift from within locally. But many patients dislike this surgery. The reason is that the surgery is not that minor. Also, after surgery, the nerves feel strange. Thus, there are techniques that simply pull the eyebrows or cut the tissue right below the eyebrows. People who have drooping eyes can benefit from this procedure. So in this person, we can remove the outer part of the brows, as that part is excessive. Also, scarring is diminished extensively after 1 year. So this type of eyebrow surgery is common.
So for our last question for upper eyelid, what are the side effects?
In regard to side effects of canthoplasty, like I said before, it happens when too open or when too closed. If opens too much, we close it. If closed too much, we open it. If we look at this patient, we try to figure out what we should do. When we examine this person, we see this part being too low. And since this person has both sides lower than ideal, we have to raise both sides of this eye upwards. We raise both sides and remove the excess fat and cut excess skin. So we look at this picture 1 month later. What do you think? Looks like a different person, right? So we must look at all the potential problems first, then think of all the ways. That way, we can limit the possibilities of a bad outcome. If we look at this person, the frontal area is too low, the rear area is too low, and overall looks too rounded. So in this case, we need to cut here, here, and here, all 3 areas. So if we try to solve this type of problem with just one technique, such as Epicanthoplasty, there will be issues. So according to the problems, we need the right solutions. That way, we limit the potential for side effects.
Epicantoplasty is a popular cosmetic procedure in Asia due to the common presence of the muscle tissue in the epicanthal layer or the Mongolian fold. Up to 70% of Northeast Asians have it, and as well as some Westerners. Long ago, surgeons simply cut the skin, so there are issues with visible scarring. But today, we feel it as a muscle tissue issue. And the skin is something that follows naturally when the underneath muscles are rearranged. So the concept is different now. While the years passed, the aim was to alter the skin, but today the technique is to relax the muscle beneath in order to achieve the desired appearance and minimizing scarring after the procedure. In some cases, epicanthal eye surgery is not just for cosmetic purpose, but also for practical reasons. Some have a pronounced epicanthal layer that obstructs vision. In such cases, the surgery offers much needed relief from vision obstruction. When the surgery is not done perfectly, there can be scarring called the sausage. The reason we call it the sausage is when the fold is too big or when the muscle tissue right below the fold has removed excessively. In such cases, we need to remove the sausage and do surgery once again. So it is important to do surgery skillfully. And if sausages appear, we can remove them and redo the surgery. In Asian countries, especially in South Korea, has ample experience in this type of surgery. There are many surgeons who are considered expert by their clients and have a long wait list. Through Cloud Hospital, you can book your procedure in an expeditious manner. Until next time, stay safe and see you once again at Cloud Hospital TV for more videos on a wide variety of topics that may be of interest to you.